So, can you start by telling us your name, your institution, and your role?
Yes, my name is Xiaoshu Pan. I'm currently a research assistant professor in the Department of Pharmaceutics at the University of Florida.
Could you provide us a brief overview of your SCGE project and explain your role within the project?
Of course. This project is aimed to establish the good manufacturing protocol and the stringent quality control pipelines for the EV-based gene editing delivery to treat the hearing loss disease. So my major role in this project is to optimize the technical strategies to achieve the GMP goals. And because the extracellular vesicles are naturally derived vesicles, so we will need to use multi-quality control assays to characterize them. So another goal is to establish the consistent, the assays with high consistency and high reproducibility that can address some regulatory issues from the FDA. Yeah.
Can you highlight some of the key differences between EVs and other delivery methods, such as lipid nanoparticles or viral vectors?
Yes, of course. As I mentioned before, extracellular vesicles are biologically derived vesicles that are utilized by all kind of the cells to deliver some biological molecular information. So compared to the viral vectors, it has broader cargo types, and they are composed of the lipids and the proteins and has the RNA, and it can be easily engineered to have the different cargoes. And for the lipid nanoparticle right now, it is like a well designed to carry the nucleic acid cargo, but for the EVs, it is like open to different kind of the cargoes. I think that's one of the major difference in terms of the delivery. And another thing is because it has a very good, it is a biological derived vesicles. So multiple researchers in different fields have proved that the EVs have very low immunogenicity and high biocompatibility. We compared to the viral vector and LNP, researchers and the physician scientists are more comfortable to do multiple dose within the short periods. So I think the safety is really the key advantage of using the extracellular vesicles.
Okay, great. Thanks. So next, your project plans to focus on evaluating your EVs in treating hearing loss. What makes hearing loss a compelling first application for your EV platform?
I think hearing loss combines the unmet medical need with the opportunity for localized delivery to the inner ear. And it is very suitable for the evaluating the emerging extracellular vesicle-based gene delivery technologies. Within these organs, um, we can easily do the biodistribution of the EVs in the inner ear and then do the in vivo gene editing of the efficiency test in the inner ear. And the volume required for this test is also very limited. So we don't need to acquire too many extracellular vesicles for this kind of type of therapeutic development. So that's kind of help us to really focus on the how to optimize the dose and then the loading strategy to make our EVs more suitable for the hearing loss treatment.
What are some of the next milestones that you're hoping to achieve in this project?
So that's a great point. So this project is aimed for to develop the good GMP strategy and then the good multi QC assays. So our next milestones including further optimize the loading strategy to largely resolve the cargo encapsulation and the scalability challenge in this field. And we want to have the well-controlled batch-to-batch variation, limited variations. And our and we aim to have the pre-IND meetings with FDA to see whether there's any regulatory issues they are having with the EVs that we can address in time and provide the standards for our future investigation studies.
Okay, great. And now, just kind of a forward-looking question. In the next 10 years, what is something that you predict or hope will happen in the gene therapy field?
Um, Over next decades, I hope that we can see the gene editing can move beyond the proof of concept cases towards a broadly accessible treatments that enabled by the safer and more versatile delivery methods and also the medical device. And I hope that the extracellular vesicles can be a big driver here to help more patients with the genetic disorders. Yeah.